Hey, OncoPT, and welcome back to this episode of the OncoPT podcast. Today's episode really comes from a recent patient interaction that I actually had, and it was a very strange, deja vu. So let me explain. So recently, I evaluated a patient who was coming in for her stubborn lymphedema. So long story short, she is now cancer-free. She went through breast cancer treatment, and she's now dealing with the aftermath of cancer treatment, like we're very familiar with. This patient had chemotherapy, surgery, and radiation, as well as reconstruction. And all of this is probably coming together to contribute to her breast cancer related lymphedema. So, long story short, she was referred to a therapist who started treating her for her lymphedema, saw some progress, and then basically kind of got to a point where she's like, I'm stable. Okay, we're good to go for a time being. And since then, she has actually experienced an increase in her lymphedema, I think, as her now therapist, likely related to the long-term effects of radiation fibrosis. All this to say, this patient has now been to multiple therapists, and her most recent therapist told her, and I quote, "The reason that you have lymphedema is because you have a tattoo. The reason that your lymphedema is so out of control is because of your nails." Now, if you're listening to this, you probably can't see the eyebrow expressions that I have right now and the eye rolls that I'm doing here. Let me be clear. This patient she has not had a new tattoo. Okay, this tattoo is years old at this point, well before her breast cancer diagnosis. That is not a new thing that is contributing to this lymphedema. This patient is also in a very professional role, where she has to do a lot of presentations. And as doing so, she likes to get her nails done. And she's been doing this for years, including when it was safe to do so per her oncology team throughout, probably not during her cancer treatments, but shortly after, because we know how cancer treatment can definitely affect nails. So I tell you all this background to let you know just how frustrated and saddened this patient was to find out that she could never, ever get her nails done again, which was something that she loved to do. And her tattoo has a lot of sentimental meaning for her. It's related to her family. She even has family members with matching tattoos. It was very much like a coordinating effort. This patient is not going to have her tattoo removed, which was also the advice of her previous therapist. All of this was extremely devastating news for this patient, on top of knowing she already knows that lymphedema is a chronic condition. She knows that she is going to live with lymphedema for the rest of her life. I firmly believe there is a place for transparency and honesty in our patient care. There is a need for it. There is a time and a place for telling hard truths in cancer rehab, because the nature of our job is that sometimes we do have to do that. However, there is also a tremendous need for kindness and compassion in cancer rehab. And I think this sometimes falls by the wayside. Cancer is taxing on, of course, the patient, but not just their physical health, but in every realm of their existence: physical, emotional, mental, relationship wise, identity, as well as not just the patient, but also the family and that immediate family unit and community unit that's helping to take care of the patient. They need support and compassion and kindness every step of the way. The last thing they need is for their rehab professional to be cruel in the name, disguised as blunt honesty or telling it like it is. When I trained at my CLT program, it's been almost 5 years, which is crazy. I feel like we learned that nail salons were the devil, right? They were basically walk-in cellulitis appointments. But after I started practicing for a few months, so I did my CLT program, I came back, actually started practicing, and I started working with real life patients. I realized just how many of my patients got their nails done on a regular basis because it was the only link that they felt they had to their old selves, to their identity, to their femininity, or whatever that looked like for them, because the majority of patients that I work with are women. And so I'm referring to my patients in that regard. Getting their nails done was one of the few pleasures that they actually found in their life. One comment that I got from one of my patients was that, I feel like it distracts patients, or excuse me, it distracts people from like my eyebrows and my hair and my eyelashes, especially as I've gone through cancer treatment and it's starting to grow back. I know that with my nails, it distracts them and it keeps them occupied, which honestly is something that I've never thought of before. And it's honestly kind of genius, but I digress. So when I'm working with patients today, instead of coming from this place of nails are bad and they're going to cause all kinds of problems and it's unsafe, da 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 da, I talk to my patients about how to be safe when getting their nails done, right? So we're talking about nail care and safety with every one of my patients, regardless if they actually go to get their nails done or not. So what this includes for me is I'm talking to my patients about how can you make sure that the nail technician is using clean equipment, right? What are some things, some practices, some strategies to avoid in the nail salon to decrease your risk of infection? I talk to them about what is cellulitis, what are the signs and symptoms of cellulitis, what to do if you think you have cellulitis, how we manage cellulitis, and so much more. And while I know there's some therapists out there who would say that I have gone soft, I would maybe agree, but I would put this caveat on it. I think this is a much more compassionate and patient centered approach to my care. It doesn't mean that I'm slacking off with my patients. In fact, I'm probably more of a stickler when it comes to exercise prescription and dosing and intensity and frequency than I used to be when I first started. What I'm trying to do is I'm focusing on the big picture, what is truly best, what is going to make the most difference for my patients in the long term. And if that means that my patients are going to get their nails done twice a month, then I'm fine with that. I had a patient literally just a few years ago who, again, for her, she was in a very customer facing or client facing job. Her nails were really important to her. She had a every other Saturday standing appointment at the local nail salon to get her nails done. And she and her technician always came up with the most fun designs. And for her, that gave her joy back into her life, especially when it felt like so much other, just frankly, things were falling apart, right? She was diagnosed with cancer. She was going through cancer treatment. She was experiencing all these side effects. She's not just in a silo, right? She's not just a quote cancer patient. She has other things going on in her life. If the nails are one thing that she can control and feel good about, then girlfriend, go out there and do your nails and then come show me what those designs are next time I see you. If that is the one thing that is going to give them joy and give them some link to this identity that is being lost throughout this craziness of cancer, then so be it. But here's how we're going to be safe doing it. And so, as a cancer rehab professional, it's essential to maintain a compassionate and patient centered approach while still ensuring the best care for your clients. And that does mean that there is going to be some give and take, right? When I started, I was really anti getting your nails done. Now I'm like, you know what? You can go get your nails done. Here's how I need you to be safe doing so. And I think this is very much something that comes with practice. And I hate that I'm saying that because there is nothing that frustrated me more as a new professional than when people would say, oh, you'll figure it out. The longer you practice, the more you'll figure it out. This is the result of 5 years of struggling to figure it out. And I wish I would have had some guidance along the way. And so I'm going to give you some tips on what I wish I maybe would have softened up on, quote, sooner or been less rigid on in the pursuit of high quality cancer rehab for my patients. And the first one is emotional expression. Now, ideally, you're curating an environment where your patients feel comfortable, obviously expressing their emotions. We know that dealing with cancer is challenging, not just physiologically, but also emotionally, mentally. There's a huge range of emotions that patients can experience, often in 1 hour, because that's sometimes what the cancer experience is, right? Like we know that patients experience fear, anxiety, depression, frustration, sadness, grief, all kinds of other things. Guilt, shame is another one. There's so much here, and encouraging emotional expression with your patients creates a safe space for them to share their feelings and ultimately concerns. And I think that's something, it's one of those lost little links of when patients can share their feelings, they're more likely to be upfront with what's bothering them, what's concerning them, and then you can help them actually get connected to resources to help with that. So, of course, as the professional in this situation, actively listening and validating our patient's emotions can be therapeutic in itself for the patient, right? But maybe also for ourselves. When we curate the space, the safe space for emotions to be talked about, for feelings to be discussed and felt, right? Not just I'm feeling this, it's man, I am really feeling insert whatever here. This can help reduce our patient's stress and overall well being. And acknowledging their emotional struggles can foster trust and then ultimately strengthen that relationship between you as the therapist and your patient, which is crucial to ultimately have effective rehabilitation. This may mean that you are telling your patients outright, explicitly, when, feelings are getting big, patients are feeling the feels, that this is a safe space to cry. I don't know how many times I've said that in a session, but that sometimes is the release, the permission that patients sometimes need to really be able to feel those feelings and to know that it's a safe space with you, right? Sometimes that means that we say 4 and 5 letter words, which are personally some of my favorites. And, whatever that looks like for y'all. And it's not necessarily just that this is a patient experience only. It's also important that you are expressing your emotions in an appropriate way, of course. But this emotional expression cannot be one sided. No patient likes a robot therapist. I mean, I don't know how many times I've been to, some appointment with somebody or even a healthcare appointment where I've been met with someone who I'm thinking of my latest actually gynecological appointment. So not my gynecologist, but the tech or whoever was doing my intake paperwork previously literally stood at the counter as I am sitting on that wonderful table with her back to me, typing on the computer, taking in my information, like checking medical history, etc. And I've never felt more like a number than in that moment. And I'm very lucky because I don't have a lot of health issues. This was like a regular visit or whatever. But how do you think that makes the patient feel, especially when they're not in the role of also being a healthcare provider, right? Nobody likes a stern robotic therapist who doesn't have any feelings, who will not share and engage in emotional expression. This also, I firmly believe, helps patients know that this is a safe space, not just know it in a very cerebral fashion, but also feel it in their heart. When they know that this is a safe space where not only can they express emotion, but it's also received and then not parroted back, but it's received and felt and expressed similarly and validated by the therapist, especially when that patient is being so physically and or emotionally vulnerable with you, is only going to strengthen that therapeutic alliance between you and your patient. So don't be a robot. I think especially as new therapists, we want to, we want to be as professional as possible. And that means that we have to show up and we're kind of stiff. And that's the last thing that our patients need. Again, I know because I remember this very clearly. My very first evaluation, my very first day of my very first job, I had a patient who absolutely cried during the evaluation. And that's okay. There was a lot going on, and I told her, this is a safe space to cry. You can cry here. Not because I needed to give her permission, but I think it's very valuable hearing that feeling that it is truly a safe space to express your emotion in. That really helps to curate the therapeutic alliance. So, number one, it's okay to express your emotions. It's okay to be human because that shows the human in front of you that you are also human, and that only helps to curate a more effective rehabilitation environment. Number two, treatment goals. In school, we learn a lot about these are the things that you need to have in your goals. We think about like SMART goals. in order to get reimbursed by insurance, etc. Then you start practicing and you realize, wow, this is not what I thought it was going to be. These goals that I'm writing are not matching at all what I thought was going to happen with my patient. There is definitely a learning curve about this, but I think cancer treatment throws a whole other curve into that. As we know, cancer treatment and the side effects can be unpredictable. Not so much we know the dosing, we know the typical regimen that patients are going to be on for their specific diagnosis, but we also know that sometimes patients don't tolerate treatment like we would hope. And so we have to make adjustments in when they're going to get treatment. When are they going to have their side effects? How do they respond to XYZ chemotherapy, for example? And your patient's response to that treatment can vary even from week to week. Being open to adjusting your goals based on the patient's changing needs and progress is absolutely essential. Perhaps nowhere else as important as it is in oncology. We know that our patients can experience different setbacks or delays due to cancer, treatment side effects and many, many other factors that they can experience. And so it's really important that we're setting achievable, realistic short-term goals. This helps our patients understand that they can actually do things. They already know this, but sometimes it really helps to hear it from somebody else. And this helps boost their motivation, their adherence to the rehab program. And so, of course, we need to be revisiting, changing, rewriting those goals as necessary as we're going throughout our plan of care. But where this really falls short, I think, a lot of times in rehab is that these goals need to be pertinent to the patient. It's not enough to be achievable and realistic. They need to be relevant to the patient's experience. And where this really comes in, and where I think we can really, really improve on this as a whole, is by having explicit conversations with your patients about, we are doing this intervention, X intervention, whatever that is, and how it is going to affect your ability to better do Y activity, whatever that is. This is critical in cancer rehab because we don't always, as humans, we don't always make the connection between how X will improve my ability to do Y. And again, you and I are the experts in cancer rehab, in movement. We know that relationship very well, but it is on us to really communicate that information to our patients and make sure it's understood, because they don't have that same insight as we do, being an external person in the situation, where we can look at this and say, okay, here's the problem. Here's how we're going to fix the problem. Share the plan, share the progress. Find common ground to make sure that you're both working towards the same ultimate goal. And this requires collaboration. And I think that this is something that I don't do very well. I have an idea of goals that I want to get done with my patient. I am not communicating those to my patient. And if I were to do that, I know that I would have a lot more buy-in to the plan that I'm setting into motion, because the patient understands, this is what's happening. This is why this is happening. This is what we're going to do about it and how it's going to make it better. Again, by working and collaborating together to really create those treatment goals, that is going to make better buy-in. You're going to see better results, often faster results, because your patients are more adherent to the plan, and ultimately happier you and the patient at the end of the day, which is always my goal with all of this. Now, personal preferences. This is something that was really hard for me at the beginning. I think I suppressed my creative self for so long because I was very into science, right? Like, you go to school and you do all these science things. And I didn't do a lot of creative activities and hobbies actually for many years. And so I felt like I was really good at taking whatever a textbook told me and then immediately putting it into action, not considering that there is a human with a lot different interests than a textbook at the end of the day sitting in front of me as my patient. So, taking into account your patient's personal preferences when designing exercise routines will significantly impact their engagement, their adherence, their motivation, their compliance with the program that you're putting into place. Again, when I first came out of school and when I was really learning what the evidence says about, cancer rehab and what are the most effective regimens and interventions, I was doing those by the book. I was not even thinking about the fact that this patient may not even like to do that activity. And if they don't like to do that activity, they're probably not going to come back to rehab. So, for example, some patients may enjoy outdoor activities like walking or hiking or biking rather than more structured exercises in a gym setting. But it's on us to figure out what that is for our patients. So, I'll give you the example of I have a walking program that is absolutely one of my go-tos when it comes to a home exercise program for patients. I've got two variations. One is a little more regressed for patients who are not as physically able to do the full walking program yet, and that's totally fine. But what I can do is I can take this walking program and I can adapt it to whatever activity that my patients actually enjoy. For example, maybe that's biking. Maybe that's, I don't know. Of course, I'm like thinking some patients don't like the idea of walking, but if you put it in an outdoor setting in nature and call it hiking, sometimes patients like that a little more, but you got to find what your patients like, right? So, this walking program as a skeleton is relatively easy to implement into daily routines, even in the throes of cancer treatment, right? There's wiggle room, there's flexibility here, but ultimately the large goal can be applied to a lot of different types of exercise. So what I'll do is I work to find out what does the patient actually like to do or dislike less than other forms of exercise, and then I marry the principles of the walking program to that particular activity in regards to frequency, intensity, duration, gradual progression, etc. By tailoring this program to the person's interests, to my patient's preferences, makes the therapy sessions much more enjoyable, makes their home exercise program much more enjoyable, which is then going to increase the likelihood they'll actually participate, and we're going to see the benefits of doing this program. If you want, I have this walking program linked in the episode page, the web page for this particular episode. You can find that at the oncopt.com/261. That's the episode for today. And you can download that for free. So again, you can find that walking program. If you go to the oncopt.com/261, you'll find that link and you can grab that too. So again, by taking the principles of this walking program, marrying it to what your patient actually enjoys doing, this shows your patient that their therapist, aka you, respects their autonomy and preferences in their cancer rehab journey. Particularly, we know how crummy and puny our patients can feel. And we know just how much control is taken away from them as part of this cancer rehab journey, just cancer journey period, cancer diagnosis period. Why not give them a little more control in their own life as to what they actually enjoy doing and making it a reality in their life, even on those really bad days? Even on the days where things really suck and they don't want to do something, they still have power over, I enjoy doing this. I'm going to go and do just a little bit of it because I know it's good for me and I know that I enjoy it. Speaking of bad days, one of the other things that I have become much more not soft on, but accommodating for, I think flexible on, are bad days. Bad days are a reality in oncology. Cancer treatment comes with a roller coaster of good days and bad days. And on the bad days, we know that patients may be dealing with a slew of very intense side effects, fatigue, and distress, right? Maybe not just even the physical side effects themselves, but also the distress that comes along with it, which makes it very challenging to engage fully in rehab sessions. And so it's on those days, I really love the Stoplight program by Lynn Tanner and colleagues. So this was primarily created actually for the pediatric patient population, but I think it's so pertinent to the entire oncology patient population. So in essence, there are going to be red days, yellow days, green days. Green days mean that the person is feeling great. We can basically go full speed ahead with our interventions, again, as tolerated. Yellow days, the person is feeling okay, not terrible, but also not great. And so with this, we may need to do some more adjustment with what kind of intensity and frequency, are we doing with this particular exercise with this patient. And again, as the patient tolerates it, we might have to pull back a little bit on frequency and intensity. We may have to increase rest breaks, but we're still getting stuff done, right? It's not like we're just saying, well, today's a wash. Can't do a darn thing. Whatever. Like, we're still doing things, again, as the patient can tolerate them. And then red days are the days where the person is feeling really crummy. They may be coming into the clinic. They may not be coming into the clinic that day. And I think as I've gotten better about patient care in oncology, I've gotten better at timing when I think those bad days are going to be, so that we're not trying to schedule patients on those really low days, like when they're, feeling really puny after chemotherapy, for example. But that does come with practice, and that's something that I'm still working on even today. And so on those red days, the person is feeling really, really bad. If they're coming into the clinic, again, maybe they're not, maybe they are, we are definitely leaning more on maybe very low intensity exercise. I'm talking like seated, maybe even supine exercise, lots of rest breaks. And maybe this is more of like an education opportunity, right? Maybe we're not doing as much therapeutic exercise and activities. Maybe we're relying more on the patient education and information that still needs to be communicated, but is more appropriate for those days. Again, instead of trying to force your person into this mold of how you want every session to go, understanding the dynamic flow and experience that patients have when it comes to cancer treatment and their side effects is really, really important to making sure, again, that your patient feels heard, feels seen, feels validated in their experience, and knows that you and your facility, right, maybe like clinic or hospital, whatever you're like, wherever you are, is a safe space for them to experience what they're experiencing and to still show up as themselves the best they can, to do the best that they can in that situation. Offering the encouragement and understanding instead of simply pushing your patients too hard can often prevent feelings of guilt or failure that the patient might feel on their part as a result of not being able to do certain things on those yellow-red days. And it really prioritizes your patient's well-being above all else. And while patients may not always verbalize that, they see that and they feel that. Again, helping to build and strengthen that therapeutic alliance between you and your patient. Now, the last factor here that I feel like I've gone, quote, soft on, or I'm softening up my stance on, are lifestyle adjustments. One of the things that I've really come to appreciate more over the last 5 years of practice, which is kind of embarrassing to say, but this is an honest place and I'm going to be vulnerable with y'all. I feel like in school, I learned so much of what causes cancer and how there's all these factors that we know contribute to cancer. But we also know that cancer is an equation, as I've talked about previously, where genetics and frankly, sometimes luck come into play. And while there are certain risk factors that contribute most definitely to cancer, there's a lot about cancer that sometimes it just happens and it really sucks. And there's not really a good explanation. And it's awful. It's the worst. And I think I came into cancer rehab with very much this, like, the reason that people get lung cancer is because they smoke. And if they just stopped smoking, like we wouldn't be in this situation in the first place. And it wasn't until, sadly, like I own up to this now, I met a patient who developed lung cancer because of secondhand smoke. She never actually smoked a day in her life, but she was in an environment where she could not get away from the secondhand smoke of someone else smoking. And it is as a result of that other person and lots of other factors, right? We know that, that is not a simple equation, that she went on to develop lung cancer. And it sucks. It's awful. It's the worst. And instead of focusing so much on, well, if you'd have done that in the first place, we wouldn't be here. Instead of approaching it with that very, frankly, like cruelty, there's a much better way that we can go about this. So after a person receives their cancer diagnosis, they may feel overwhelmed by the prospect of making significant lifestyle changes to improve their health, because some patients are frankly doing the best that they can with what they've got. And they're just making it through, and they're just getting by, right? As the professional, as the cancer rehab professional in the situation, it is essential for you to offer guidance on lifestyle adjustments with a realistic, patient-centered approach. So rather than imposing very drastic changes all across their existence at once, we should be encouraging gradual and sustainable modifications that really align with the patient's ultimate goals, as well as what they are capable of and what they prefer. So maybe this is providing advice, right, on how can we incorporate more healthy, healthful habits into their daily routine, right? Maybe that's regular physical activity, a more moderate, balanced nutrition plan, right? Stress management techniques, rather than like, we're going to change everything all at once. So supporting the patient through their efforts to adopt a healthier lifestyle will ultimately influence both their physical and emotional recovery. And we know that these little changes do really add up over time. We know that these make a difference in our patients' well-being, as well as their quality of life, and maybe even their prognosis and survival rate, right? These are not little in the grand scheme of things. They actually really, really add up over time. So rather than being discouraged by, wow, I've got this patient who, does XYZ, of course they have cancer. Okay, wrong attitude altogether. How can we make small changes? How can we equip and empower our patients to make those small changes that are going to help them feel good in the long run, as well as like tomorrow and next week, right? One of the patients who this rings so true for me, a few years ago, I was working with a patient who had metastatic breast cancer. And due to her diagnosis, she experienced a ton of cancer-related pain, right? It was metastatic. It was in lots of other places, I believe, including her lumbar spine. That's me guessing, but I'm pretty sure something along those lines, right? Lots of pain leading to a lot of increased sedentary time. Now, this patient was previously probably very sedentary, but it had increased so much more with this onset of her cancer-related pain. And so we're working together. She had a lot of issues going on. And after 3 months of working together, she was finally walking independently around her apartment complex for the first time, I think in like 2 or 3 years. This was huge for this patient. So what she would do, because it was summertime and it was stupid hot here in Texas, she would get up early in the morning and she would walk inside her apartment complex, basically like around the inside. And then she would come back in and she would get to rest in her nice, cool apartment. And that is what we found worked for her. And that did wonders for her, not just physically, like how she felt, but also emotionally. It was enormous progress from the patient who first came to me, who was frightened and anxious and in pain all the time, to this woman who she still had some pain, right? I did not fix the pain. But she felt better. She felt accomplished. She felt like she was actually doing something for herself. Again, when so much control had been taken away from her. And this position that we're in, where we can offer guidance on lifestyle adjustments, is so powerful. And it does make a change. It does make a positive effort, or a positive energy into a situation where a lot of times things just freaking suck. And so we have a real opportunity here to not impose drastic changes, but really offer solutions for our patients, equip them with strategies by which they can make sustainable, gradual changes to make themselves feel better in the long run. And I think that is one of the coolest things. Again, instead of trying to go full ham, which is what I used to do, these gradual changes are so, so powerful. And it's really, really cool to see the patient change and develop and grow along the way. I'll finish with this. Compassion and kindness are not the same as going soft. Compassion and understanding, leading with these things, can positively impact your patient's mental and emotional well-being, which do ultimately play a significant role in their overall cancer journey and recovery, right? And recovery is kind of a funky term, I think, in oncology, because sometimes we know that recovery isn't always the goal, which is why I tend to use the word journey. Everyone's journey is a little different. So think back to the patient that I just mentioned, the patient metastatic breast cancer walking around her apartment complex, okay? After 3 months of working together, she's finally walking independently around her apartment complex, and she's finally starting to feel this confidence, right? She was extremely shy and felt a lot of guilt and shame, like she had caused her diagnosis and that there was nothing she could do about it, and like she had brought this basically on herself, when in fact that was not the case. And frankly, that's never the case in oncology. So we had worked together for 3 months, finally got to this point. And at this point, I took a few days off and I actually went on a weekend getaway to visit my sister. This is important. I'm not just talking about my social schedule. A substitute therapist came in to treat my patients while I was gone. And by the time I came back, my patient had canceled all of her remaining therapy sessions. She swore to never return and had stopped walking altogether. Here's what happened. In the 1 or 2 visits that my patient saw this substitute therapist, this sub-therapist tore into my patient about how she was always going to be fat, how her lymphedema and her cancer were because she was fat, and how walking wasn't going to do anything to help her, and she should basically just accept that. In the 1 to 2 visits that this sub-therapist saw my patient, all of the work that we had done over the last 3 months was ripped away from her and belittled to nothing. And it took the remaining 4 weeks of my time that I was actually at that job, because I was leaving in 4 weeks. This was already discussed in advance. It took me 4 weeks to get her back to even considering walking again. It took convincing to get this patient to come back to the clinic so I could talk with her about what happened. It took 1 or 2 visits with that therapist who crushed my patient to nothing to undo all of the work that we had done over the last 3 months. This happened several years ago, and it still upsets me to this day, as I'm sure you can tell in my voice. But I know that it demonstrates my point today, which is there is a time and place for telling hard truths in cancer rehab. I understand that. But there is also a tremendous need for kindness and compassion in cancer rehab. And I think that the kindness and compassion outweigh the hard truths experience. Kindness does not mean, to me, brushing over things or ignoring them or not talking about things. Kindness and true compassion comes with honesty. They're related. but it's all about how you do that. I don't have a good ending for my patient story. Like I said, I left at the end of the 4-week time period after I left, came back, etc. It took me a really long time to get to where that patient was interested in walking again. I don't know what happened to her. I don't know if she went back to walking again. I do know that she did not have a physical therapist for a while, because once I left, there was basically nobody there for a few months. But I know the pain and I know the hurt that that patient felt. And I never want another patient to feel that ever again, especially in oncology. And so I'm challenging you today to approach every patient, every visit with intentional kindness and compassion. Because in doing so, you will create a more supportive and compassionate environment in which your patients can truly heal. And that may not be fully physically healed, right? That may not be fully emotionally, psychologically healed, but they know that this is a place of healing and growth. And you can foster a true sense of trust with your patients that is reciprocated, right? Not just me trusting my patient, but my patient also trusting me. An environment which is motivating and encouraging and supports their overall well-being as they're on this cancer journey. That is my challenge for you today. Until next time, this is Elise with the OncoPT. And remember, you are exactly the physical therapist that your patients with cancer need. So let's get to work.